Welcome to Community Connections. I'm your host, Mershai Sahalu. In this episode, we're focusing on a critical topic, mental health. Montgomery County Council President Kate Stewart has made mental health support a top priority, spotlighting the resources and options available to residents so they can get the help they need. One of the key findings from the county's 2022 health survey was that mental health emerged as the top health concern, with 18.3% of residents identifying it as their most important health issue. That's exactly why Council President Stewart has centered mental health in her agenda for the county. Today, we'll highlight the outstanding work of 3 community organizations. First up, we visit the Chinese Culture and Community Service Center in Gaithersburg, a one-stop shop, culturally tailored clinic offering primary care, dental pharmacy, rehabilitation, and robust mental health services. In the heart of Montgomery County, the Chinese Cultural and Community Service Center, better known as CCACC, has been a vital resource for the local community since it was founded in 1982.
43 years in service already, serving mostly the new immigrant and people who are facing barrier merge into the society. So they need someone to bridge the gap. And also we help them with the assimilation process and also advocate for rights and resource for the community.
Known for its cultural programs and social services, CCACC also plays a critical role in addressing a growing issue, mental health.
Building up.
Kate Liu is the Health Center Director.
We have everything pretty much mapped out. We have a business plan.
CCACC is breaking barriers by providing culturally competent services. They offer therapy sessions, crisis intervention, and educational workshops, ensuring that language and stigma are no longer obstacles to care.
We build mental health into every service we have here. As you can see, there's many different service here, like in primary care, rehab service, and a lot of community health program. So like I said, we screen everybody who come in for medical service, and we can identify the need right there. So we address the mental health part without the patient knowing they're getting that.
So did you expand your services based on the needs you were hearing from the community?
Yes.
Over the years?
Over the years, we always see what is needed, then we build up something. We have community education program. We just have a youth mental health first aid training in Chinese. And we have 21 parents come join the virtual meeting and speak freely of their concern and have some education.
Through partnerships with government, schools, healthcare providers, and local organizations, CCACC is expanding access to mental health care, ensuring that support is available when it's needed most.
We were very lucky to get recognition and support from Montgomery County. So the Mental Health 360 program has been getting community grants since 2015. But it's a great encouragement and support for us to keep this program going.
By addressing mental health with compassion and expertise, CCACC is making a difference, one conversation at a time.
I am very happy to say that as a mental health professional, I see a lot of changes. At the beginning of my career here in CCACC as a mental health professional, people are scared of even having an eye contact with me because they know if I lay eye on them, that means they have a problem. But nowadays, seniors tell me, hey, when is my time to talk to you? I have problem I want to spend time and talk to you about. So it's very, I think it's very rewarding and knowing that there's a lot of acceptance on mental health service in the community.
Next, we spotlight the Encuentros program at Identity, not just a name, but a lifeline for Latino residents seeking mental health counseling in their native language. In the heart of Montgomery County, identity is transforming lives through a powerful blend of connection, culture, and care. At the heart of this work is Encuentros, a program inspired by a simple but profound idea that mental health matters and everyone deserves a space to be seen, heard, and supported. Leading this transformative work are Diego Uriburu, Executive Director of Identity, and Program Director, Carolyn Camacho.
During COVID, many of our therapists decided to leave and start their own practices. Our population was suffering emotionally, and we met with the community, and they shared that in many of their home countries, they did not all go to see a therapist when they had to deal with social emotional issues, anxiety, depression, that they turned to trusted individuals, for support. And that basically started this. Community had an idea that needed to be tested. We tested it out, and the results were amazing.
Unas tremendas esculturas.
The word encuentros means like a coming together. So as Diego said, this was a program that we designed with the community, for the community, and we're implementing it together with the community. And I think that's been the secret to its success.
Since 2021, Encuentros has served more than 4,000 adults and 2,000 youth. Unlike traditional mental health services, it meets people where they are, emotionally and culturally. It focuses on storytelling, group dialogue, and community building to create a supportive environment that feels familiar and safe.
The other thing that is extremely important is that our communities have always been on the side of being recipients of services. They went from being recipients to being providers. They are the ones who have the solution. They are the ones running the sessions. They are the ones recruiting. So suddenly the power shifted from providers to the community itself.
Diego is grateful for the strong support he received from the county when he first brought the idea of Encuentros forward.
Encuentros could have never happened if not for the county, HHS, particularly the Latino Health Initiative, who we went with the idea, said this is what the community is saying, and they could have said, no, sorry, we're going to speak with Dr. such and such. But they said, yes, let's explore it. It sounds like a great idea that the community is empowered and feel they have a solution. Let's test it out.
At the heart of Encuentros is the power of culture. By honoring language, traditions, and shared experiences, the program helps break through the stigma that can keep so many from seeking support.
It's the community themselves that have been the ones that have been key to demystifying the mental health, and because they're often recruiting, people are coming to the group because they've been invited by someone they know. I think that's really been the key.
From moments of breakthrough to stories of personal transformation, Encuentros is shifting the narrative around mental health. One story, one gathering, one encuentro at a time.
Having served 6,000 youth and parents over the past 3.5, 4 years is really impactful. How do you see 6,000 clients one-on-one at a time where people really need it?
Diego and his team hope to one day expand its reach.
The dreams of maybe one day this becoming a community-owned national model that could be could be implemented in many other communities across the nation.
To learn more about Encuentros and the work Identity does, visit their website. And finally, we bring you to WAMCO in Poolesville, where residents benefit not only from WAMCO's essential food and utility assistance, but also from a vital partnership with Montgomery County's Department of Health and Human Services. In the heart of Poolesville, where resources can feel distant, one community partnership is bringing mental health care closer to home. WAMCO Help, a nonprofit serving Western Montgomery County, has long been known for helping residents with food, transportation, and emergency needs. But now, it's also become a place where people can access mental health services right in their own community. That's thanks to a vital partnership between WAMCO and Montgomery County's Department of Health and Human Services. Through this collaboration, HHS clinical social workers regularly meet with clients at WAMCO to provide mental health support.
We come to WAMCO twice a month right now. It'll soon be 3 times a month to provide mental health services and assist people with their social determinants of health. Access to resources, applying for benefits, anything that might be a barrier to them. It makes me so happy you're here in person. That makes me so happy.
Nairi Iwanal is one of HHS's clinical social workers who makes this work possible.
If I see somebody who needs some extra food, we're able to bring them over here.
This effort is part of the county's Mobile Health Clinic initiative, which officially launched its new RV at a ribbon-cutting ceremony held recently at WAMCO in Poolesville, marking a milestone in bringing On Wheels medical, dental, and mental health care directly into underserved neighborhoods.
What's unique about WAMCO is they're a respected organization in a really rural community. And having that system of a trusting agency already be established in the county, and it's not the government coming in to help people. The referrals actually come from WAMCO. WAMCO's talking to people about our program. They're asking for help with certain things.
It's a model that works, especially in rural areas like Poolesville, where access to behavioral health services can be limited.
The Mobile Health Clinic is a new program within DHHS Public Health. It really is a mobile office building that's a medical clinic. We have a dental chair, we have a lab, a laboratory, phlebotomy station really. We have a counseling office, there's another medical office, and it's really a full mobile health clinic. We really try to be person-centered, like trauma-informed, and just hearing it however the person's saying it, and really listening and providing the resource, whatever they may be, and really thinking creatively about that. And so I think that has contributed to some of the barriers and gaps in care. We're an episodic program. We provide short-term care. And so when we're assessing somebody and attempting to link them to a long-term provider, it's really hard to do when the number of providers that accept Medicaid in this area are very hard to find. And if somebody really wants somebody in person, or they don't know how to use a computer really well, or don't have internet, it makes the virtual appointments really hard to access. Whatever you want to call it, there's help. And I think that's what that gap is what people don't understand. I think that's why it's important to have organizations like WAMCO and the partner agencies.
Through partnerships like this, Montgomery County is expanding access to care and making mental health a priority for all residents, no matter where they live. To learn more or support WAMCO's efforts, visit their website. And to learn more or request the Mobile Health Clinic,
if people would want to request the Mobile Health Clinic be in their community, they can look us up, DHHS Mobile Health Clinic, and send us an email to request us at a community event, or there's a calendar on there of the sites that we'll be at.
Well, that does it for this episode of Community Connections. For County Cable, I'm Mershai Sahalu. Thanks for watching.